We will discuss surveillance. What is surveillance? Surveillance is monitoring. It's a continuous process. We will discuss this session according to following learning objectives, like we'll define the surveillance. What are various types of surveillance? What are various methods of surveillance? In the end, we will summarize the session. So let's start with definition. What is surveillance? We can say that it's an ongoing process. Surveillance is ongoing process, or it's a continuous process. Ongoing process of what? Ongoing process of data collection. We collect the data, then we analyze the data. Ongoing process of data collection, data analysis. Then we interpret the data. After interpretation, we disseminate the data. So it's ongoing process of data collection, analysis, interpretation, dissemination that is used for health planning. All this is a continuous process. So we can rewrite this. So we can say that surveillance is a continuous process. It's an ongoing process of data collection, data analysis, data interpretation, dissemination of data, which is used for health planning and management. It's an integrated process. All this process is necessary or important to control the diseases. We need to collect data regarding disease. We'll analyze the data that burden is decreasing or increasing. We'll do interpretation that there are risk factors. We'll disseminate, we'll tell the people, we'll tell the authorities that burden of certain diseases is increasing. Risk factors are increasing. They are causing burden on hospitals. So then we'll make plan. Why we'll make plan? For control. It is integrated. Someone is collecting data, someone is analyzing data, someone is interpreting data, someone is disseminating. So what are various types of surveillance? There are categorical surveillance. There are syndrome surveillance. Then there is sentinel surveillance. Then there is risk surveillance. Categorical surveillance for certain category, certain disease, syndrome surveillance for certain syndrome, sentinel surveillance for missing cases, risk factor surveillance to identify risk factors. Then there may be integrated surveillance. So let's discuss them one by one. Categorical surveillance. We identify a certain category. So identification. Then we will search. Like someone say that cases of asthma are increasing in winters. So you will do categorical surveillance. Then there is syndrome surveillance. You have to identify syndrome like Down syndrome, Turner syndrome. What is syndrome? Which has multiple effects or multiple infections combined to cause a syndrome. You do syndrome surveillance to identify a syndrome in a population in a specified time period. Then we said that there is sentinel surveillance. What is sentinel surveillance? That is done for rare diseases. In rare diseases, we miss cases because number of cases are few. So this is done for missing cases. It is a common university question. Define sentinel surveillance. Sentinel surveillance is a type of surveillance that is done in rare diseases to identify missing cases. Like cancers are rare in our community. Like penile cancers are not common, less common in Pakistan. So we'll do sentinel surveillance to identify cases of penile cancer. Then there is integrated surveillance. Integrated means all the approaches, both active and passive surveillance, are used in this. Like in case of coronavirus, we do integrated surveillance. We need to identify the cases either in a passive way or either in an active way. Then there is risk factor surveillance. Like surveillance of ischemic heart disease, because it has multiple risk factors, or multiple risk factors are involved in ischemic heart disease. So we have to do risk factor surveillance in ischemic heart disease. Like we have to search smoking, hypertension, diabetes can cause ischemic heart disease, stress, they can cause ischemic heart disease, lifestyle can cause ischemic heart disease. So there is risk factor surveillance. What are various methods of surveillance? There are two methods which are commonly used for surveillance. There is active surveillance and passive surveillance. What is active surveillance? As the name indicates, you actively search the cases. You do initiation. Researchers take initiative to identify diseases. This is active surveillance. Our researchers are taking an initiative to detect cases of coronavirus in a community. This is active surveillance. So, researchers initiate this. Or in chronic diseases, in cancers, researchers initiate the screening of breast cancer. Researchers can initiate the screening of cervical cancer. Researchers can initiate the screening of prostate cancer. Or they see the burden of disease in the community. This is active surveillance or active method of surveillance. What is passive surveillance? Where we don't initiate. Patient comes to you. Patient comes to you in the hospital with certain signs and symptoms. You diagnose the case, then you do surveillance in that area. So it is initiated by patients. Or we can say that patients give clue to researchers. Then they find. Patient can give clue. Then researchers identify surveillance or identify the cases in the community. This is retrospective process. Active surveillance is prospective process. This is the difference between active and passive surveillance. It can be asked in examination. Active surveillance is prospective. Passive surveillance is retrospective. Then we will summarize the session. What we have discussed surveillance and its types and its methods. We have discussed surveillance is a continuous process. It's an ongoing process. We do monitoring continuously in any plan. Like in planning, we do monitoring from first step to last step. While conducting a study, we do monitoring from first step to last step. While do prevention of certain disease, we do monitoring. We do continuous monitoring. We continuously collect data. We continuously analyze data. We interpret that. We disseminate that. Why we disseminate that? For awareness, for planning, for management. Aim is to control the problem, to reduce the burden in the community. Surveillance is a stepwise approach. Certain steps are involved in it. Like you start from collection, you end from dissemination and feedback. You have to follow all the steps to control that problem. You can intervene at various steps. After identifying the problem, we can intervene. We can't intervene without prior detection of a disease or detection of cases or detection of signs and symptoms. Iceberg tells that spectrum of disease in the community varies from spectrum of disease in clinic. In clinic, more cases, 80-90% cases, they don't appear. They are asymptomatic. We do surveillance. We find them. When we find them, we prevent others or we protect others. Like in case of coronavirus, we do surveillance. We isolate them. We isolate asymptomatic cases. In case of typhoid, typhoid spreads to carriers. We isolate them to protect the community. This is surveillance. And its types: categorical surveillance, ask-in examination, surveillance of asthma. You can do surveillance of asthma. This is categorical surveillance. Syndrome surveillance, we need to identify syndromes like Down syndrome surveillance. Risk factor surveillance, surveillance of ischemic heart disease, surveillance of diabetes, or surveillance of risk factor of disease. Risk factor of ischemic heart disease is risk factor surveillance. Then we discuss sentinel surveillance, rare diseases which are less common, whose prevalence and incidence is rare or less, like penile cancers are less common in Pakistan. We do sentinel surveillance to identify them. Integrated surveillance when both approaches, active and passive, are combined. In case of coronavirus, we have to do both active and passive surveillance. Patient may guide us. We may take initiative. What is active and passive? When we take initiative, when as epidemiologist, as researcher, we take initiative, this is active surveillance. But when patient comes to us, we diagnose it, and then we do environmental surveillance. We identify other cases in community. We find cases, we do search. This is passive, active surveillance. Uh, this is active and this is passive surveillance. So we do surveillance by screening. We do screening. We perform screening tests in the community and then we identify it. After identification, we protect others. Remember the aim: health promotion, disease prevention, protection of people, healthy community, community diagnosis. This all is included in surveillance, planning, management. You do planning accordingly. You do management accordingly. You implement your plan accordingly. So you have to do surveillance or monitoring. We are doing surveillance. We are doing surveillance in diseases in our health system. Health system needs surveillance. Disease needs surveillance. Everyone needs surveillance. That's all.